Americans are beginning to see what it means exactly to lose the federal subsidies that lower Affordable Care Act premiums. According to the Wall Street Journal, the average increase in premiums for ACA plans will rise 26% next year. Let's bring in MSNBC medical contributor Dr. Vin Gupta. Dr. Gupta, always great to talk to you. Let's dig into some of these numbers a little bit. We're hearing it from both sides of the aisle as we've been talking about concern from members of Congress about what next year looks like for their constituents, whether they're Republicans or Democrats. What's the impact on health care?
Well, good morning. It's pretty significant, and it's going to be felt across the country, regardless of political divide or partisanship. Let's take an example here. A family of four in Maine, Willie, that makes $130,000 in total, would see if there is no extension in these subsidies, and these subsidies were put in place by the Affordable Care Act over 10 years ago, they're going to see their annual premiums increase by $16,000. For your entire audience here, go to healthcare.gov. Open enrollment for health insurance begins November 1st. So if you want to make a change, if something's happened in your personal life, November 1st, usually to January 15th is when you can make a change to your health insurance policies. But Willie, we're seeing already some states post these increases in their premiums. We're seeing somebody a couple that's making $85,000 a year in total in Kentucky, say if they're 60 years of age, are going to see an increase of 25% in their annual premiums, but $23,000. What's going to happen? People are going to go under or uninsured because they can't afford that increase.
Yeah, certainly in the next couple of days, Dr. Gupta, people are going to feel this more and more. Switching gears, government being involved in healthcare, sort of an odd headline to some. The state of California now looking to produce its own insulin. I know you wanted to weigh in on that. What do we know? What do you make of this?
No, I think it's a brilliant move from the largest state in the union because they have purchasing power. They have 40 million plus citizens. The Newsom administration a few years ago through CalRx said, you know what, we have a federal government that maybe every 4 to 8 years we can't rely on when it comes to stable healthcare policy. So we're going to do something different. And so they contracted directly with a manufacturing company and said, we're going to invest in producing our own insulin. And regardless of what happens, say with these healthcare exchanges, we'll make sure that insulin is affordable, even if, let's say, you don't have health insurance. And that's exactly what they're doing. Less than $50 for a month's supply of long-acting insulin. They're going to do the same for short-acting insulin. Jonathan, they're doing something similar for naloxone. The Newsom administration has talked about doing this for asthma inhalers, which is bulk purchasing of asthma inhalers. And so you might see this be a paradigm for the country, but with an uncertain policy disposition in D.C., states going their own way, California really in the lead.
MSNBC medical contributor Dr. Vin Gupta, thank you very much for coming on this morning. We'll see you soon. And coming up, we're going to dig into new reporting on the plans for President Trump's White House ballroom, its cost, and who our next guest says is really paying for it. That's straight ahead on Morning Joe.